name is Madi, and today I'm going to be demonstrating subcutaneous injection. So first things first, I'm going to go ahead and collect my supplies, make sure I have the correct supplies. So I'm going to make sure that I have a 3 milliliter syringe for heparin. I'm going to make sure I have the correct subcutaneous needle, which usually is 25 to 27 gauges and 5/8 inches. I'm going to make sure I have some alcohol prep pads. I'm going to make sure I have some gauze. I'm going to make sure I have a Band-Aid if needed. And I'm also going to make sure I have the correct medication. This is going to be my first time checking to see I have the correct medication in the EMR. We have to check 3 times. So I have to make sure that I have heparin. And it's going to say... Okay, so I have to make sure I have heparin, 10,000 units. Okay. And my order reads heparin 1,000 units subcutaneous per 1 dose. So I'm going to be giving 1 milliliter per 1,000 units. Okay, so I have all of my supplies. I'm going to go ahead and list the 6 ranks of medication. I'm going to have the right patient, the right time, the right dose, the right drug, the right route, and the right documentation. So I'm going to go ahead and knock on the patient's door, close the door for privacy, hand hygiene, introduce myself. Hi, my name is Madi. Today I'm going to be your nurse. I'm going to do 2 patient identifiers. Do you mind telling me your first name and your last name? Okay. And then can you tell me your date of birth? Thank you. Gonna check the patient's wristband, make sure that matches. Perfect, that matches. Do you have any known drug allergies? No? Okay. Make sure that the patient's wrist also doesn't have a band that says known allergy. Okay, so I'm gonna go ahead and be giving you some heparin today. For this injection, it usually goes inside of your abdomen. It is a subcutaneous. Have you had heparin before? Yes? Okay, so even though you did have it before, I'm going to go ahead and let you know that there might be some slight burning and some slight stinging. For common side effects, it basically, you can have like bruising at your injection site, as well as itching, stinging, and burning. And then it's also an anticoagulant, so basically helps stop the formation of any more blood clots that you may be starting to have, as well as slowing down that you have already inside of your blood. And if you have any adverse side effects like black starry stools, severe abdominal pain, and severe headache, you let me know right away, or you give a call back to the clinic. Okay. So now I'm going to go ahead and also let you know that subcutaneous can also be underneath the arm as well. I'm going to go ahead and hand hygiene again, and I'm going to get my injection ready. First things first, since this is a multi-use vial, I'm going to go ahead and gonna discard that, clean my thing. While that is air drying, I'm gonna go ahead and open up my syringe, discard of that, as well as my needle, discard of that. I'm gonna go ahead and put this one here. Go ahead and enter some air up until 1 milliliter. I'm gonna take this off, going to going to go ahead and take this out. I'm going to recap it by the scoop method. Oh shoot. Okay. And then I'm going to make sure we have no air bubbles. Make sure it's at 1 milliliter. 100%. Okay. Here it is. Okay, there is an air bubble right there, so flick it off, and now it's gone. Wait, is that it right there? Perfect. Okay, so now that there's no air bubbles and it's at 1 milliliter, I'm gonna go ahead and set that down, set my medication off to the side. For the location of the injection, it's going to be on the abdomen, so I have to either choose 3 fingers away from the belly button on the left side or 3 fingers away from the belly button on the right side. I'm gonna go ahead and make sure there's no swelling, no edema, no bruising, no scarring, or anything like that. Okay, perfect. I'm gonna go ahead and clean the patient's area that I'm going from the inside going onto the outside. Okay, perfect. And because it is heparin, you have to make sure that you squeeze the patient's abdomen and inject. I'm going to let that dry. And then I'm going to get my gauze ready on this side since I am left-handed. And then I'm going to get off. And I'm going to inject at a 45 to 90 degree angle, making sure my bevel is up. And I'm gonna go ahead and inject. Okay, going to go ahead and secure. Okay, gonna go ahead and grab my gauze, cover that, take that out. Apply pressure, and then I will go ahead and dump this. First I would put the safety on, and then put it into the sharps container, which is the red container. But because it doesn't have a safety, I'm just gonna go ahead and recap it, just in case I have to redelineate. Okay, now that I applied pressure for a good amount of 30 seconds, I'm gonna go ahead and take that off. See if the patient needs a Band-Aid. The patient does not need a Band-Aid. Ask the patient if they're comfortable. Are you comfortable and okay, Ms. Tupou? Yes, okay. I'm gonna go ahead and clean up all my supplies. I'm going to take off my gloves, hand hygiene, and document the procedure.